Hello and welcome to Askimo TV. Today
Yes, can hear you.
Kannan,
Loud and clear.
surgeon at the Dr. Chambers Aesthetic Clinic in the UK in London. Hi, Dr. Kannan, how are you?
Good morning, hi.
Dr. Kannan, let's talk today about facelifts. What is a facelift and why do women choose to have a facelift?
A facelift is essentially a procedure to put structures back on your face to back they were before. And what essentially happens over time is that the facial structures, the fat structures, the skin, they tend to droop. So you've got the mid-facial region, and that tends to droop. And you've got the skin and the fat around your jawline, which also tends to droop. And that gives an illusion of aging. And that's not helped by skin over time losing its elasticity and its springiness. So a facelift is a procedure to basically put the fat and the skin back to where they were, earlier in life, and to give a more youthful appearance to the patient.
Talk me through the procedure and what actually happens during the procedure.
Well, there are different types of facelifts. They are done differently, but the basic principle are mainly three things. One is that any excess skin is removed, and the region or the direction of that, if you can try and imagine pulling your skin back on your cheek along your jawline, that's the direction in which we will remove excess skin. The second thing that we do is, along with that, there are fat pads just under the jawline, and they again it's called jowls. It gives an impression of age. So by doing that, we reposition that fat higher up, again to redefine the jawline, and a redefined jawline makes you look younger. The third thing about a facelift is that it will push up the cheek fat pads. Now, very often if you look at yourself from a younger age, if you are growing older, you'll find that the cheek pad drops, and it gives out a sunken, hollow look around the eye, and again that makes us look tired. It makes us look old. And the idea of a facelift, or certainly a mid-facelift, would be to get that cheek fat higher up so that you have less crease and wrinkles around your face. And again, that makes you look younger.
What are the risks to the surgery that people should be aware of before considering a facelift?
Well, a facelift is from a surgical point of view, there's a risk of bleeding, torrential bleeding. There's a risk of infection. The skin can sometimes die off. So if too much skin is excised, if it's too tight, some of that skin may not survive. Particularly where we put the sutures in, you may lose a little bit of hair. That's also a risk. But by far the major risk would be damage to the nerve structures which are under the skin. And those are the nerve supplying parts of your face. In particular, the nerve that commonly tends to get affected in a facelift are the nerves which supply the lower lip. So it could lead to somebody, for example, trying to eat something, and they have drooling because one part of the lip can't move and the other part moves. So it looks different, and it can be a source of embarrassment. And that is one of the common causes, common risk that you have to take when you're doing a facelift.
How soon will a patient see results after their facelift?
I would expect you wouldn't really see a result until you're about 4 to 6 months down the line. This is a procedure where we have to lift the skin of the face off to get to the fat around your face. And there's going to be a lot of swelling involved. And on the face, even the slightest swelling shows. So you're looking at about a good 4 to 6 months before you can see that swelling settle down and really look at, more or less final result. but it could take up to a year in some instances.
What should or shouldn't patients do post-op in order to recover as well as possible from their facelift?
I think more than post-operatively, it's a decision pre-operatively. So if a patient has high blood pressure, that blood pressure has to be controlled. If you're diabetic, that needs to be controlled, because if your blood pressure is high, you have a propensity for bleeding. If you're on medication that tends to make you bleed, like aspirin or warfarin, that again is a risk factor. If you are smoking, it could propensate, some of that skin could die, and that could leave not as good a result. And of course, in fair-skinned people, if you're out in the sun, a lot of sun, then you need to cut down on that. Make sure you protect your skin at least for 6 months before. And I think it is as much pre-op as is post-op. It's a bit like preparing the ground before planting. So like that with a facelift, you've got to prepare your skin, prepare yourself psychologically to go through the operation. Once you reach the post-op stage, it is mainly a question of rehabilitation. So your blood pressure is controlled, or if you have any blood pressure, you basically take it easy, avoid straining. I think pain relief is one of the major things after a facelift. You need to make sure, the doctors always make sure, we make sure that you're comfortable. But if you aren't, that can shoot your blood pressure up, can lead to increased risk of bleeding. And bleeding is bad in facial surgery because any blood there becomes scarred, and you don't get as good a result.
Thank you, Dr. Kannan.
And I think also from a social point of view, the other thing is, you're welcome.